Joining us now, former White House advisor for health policy, professor and vice provost for global initiatives at the University of Pennsylvania, Dr. Zeke Emanuel. He's an NBC News and MSNBC medical contributor. Zeke, good to have you on. If people are practicing social distancing when they do travel to open states, is it a concern?
If you're going outside and you are socially distanced and wearing a face mask, it should not be a concern. We've had low rates of transmission in outdoor settings. On the other hand, if you're crowding beaches and then you're going into a restaurant and doing other things, that is obviously the moment when you can spread. What we know is that spread is most common when you're inside for a while, breathing air, and the ventilation is not up to snuff. And that, I think, is the big worry. It's not just that people go to beaches, they then go to restaurants or they go into stores and they linger, and that is the worry. And I think this kind of travel
for a second, if you don't mind, Zeke. Let me underline that for 1 second, because it seems that every couple of days on Twitter, somebody finds a telephoto lens of people walking on a beach that makes everybody look like they're crammed together. But what Mika and I have been arguing for some time is it's actually good for people to get outside. It's good for them to get into parks. And if they're going on the beach and they're going with their families, they're going with people that have already had the disease, that have the antibodies, actually getting outside and walking, as you said, that's a positive thing. Going to parks and walking's positive. Going to beaches and even walking down streets with their social distancing, it's good for people's health. Like I'm thinking it probably helps them and their lungs. And if you're social distancing and you're outside, there's very little evidence that is going to cause you any reason to worry about this pandemic.
Joe, you're half a doctor, and I agree with you, which is, and I've been advocating since mid-March that we should not lock down state parks. We should actually, you got to regulate the number of people on beaches so that they don't crowd. But being outside is very good. It's good for mental health. It also, as you point out, there are very few cases of transmission documented outside. And I think it's something we ought to be encouraging, not discouraging. I will just admit, last night, my partner and I went for about an hour walk in Rock Creek Park in Washington, D.C. On Saturday, we went for a 28-mile bike ride. Those are good things. It is, as you point out, important to get outside, important to stretch your legs for exercise, but also important mentally not to be cooped up in the house the whole time. You do have to adhere to the physical distancing and the masks, and those are important things. But getting outside is also important. I've actually tried to encourage Washington, D.C. to close some streets because I think it'll encourage people to use and walk outside.
Yep. So let's talk let's talk really quickly about the possibility of eating outside at restaurants. If a lot of restaurants are taking away half the tables, and again, you're outside, you have social distancing. If people are wearing masks for the most part while they're coming there, talk about the possibility of that. Give us your latest on airplanes. If you had to fly from New York to L.A., it's a question Willie asked yesterday. Would you do that? Secondly, and third, could you touch on how sticky this virus is? Because at the beginning we heard, oh, well, it can live on stainless steel for 3 days. It can live on plastic for 3 days. It can live on surface. What are we actually learning? Because I haven't heard of anybody getting the coronavirus because they went to a drugstore or because they went to a grocery store and picked up, some steak and took it home. What do we know right now about that?
So really good set of questions. The first and most important thing to remember is that getting infected, getting transmission is you need to see a high amount of virus over a prolonged period of time. And that happens indoors, not out of doors. It also happens when people cough or sneeze near you, because that projects a large number of particles and it goes deep in the lungs and brings up the coronavirus if they're infected. Those are the scenarios we have seen transmission. People singing and projecting a lot of air, or family gatherings over 4 or 5 hours indoors, or parties or conferences where the same people are together for 4 or 5 hours, rebreathing the air, and the ventilation isn't good. Restaurants outdoors, I think we're really beginning to understand having people outdoors, having tables spread out so they're 6 feet away, having wait staff wear masks and gloves. Those are probably very, very safe, and probably the places you do want to open up first, not restaurants where people are sitting indoors. And that's one reason that the summer may turn out to be very good for us. The transmission of the virus may go down a little bit. We don't know. But we'll be spending a lot more time out of doors, and we can distance, and that will be a good way to reduce transmission, as opposed to being in March, when it was still cold outside, indoors, where transmission can happen. Planes are complicated. We don't know for sure about coronavirus on planes, but we do know about flu on planes. We know that planes have very good ventilation systems, but if you're sitting within 2 rows of someone who has the flu, it significantly increases your likelihood of getting the flu, because even with a good ventilation system, that person is breathing near you, that person might be coughing and sneezing near you, and that's what the concern is about flying for a prolonged period of time. Not that the ventilation isn't good. The ventilation is better than your house ventilation, but you're stuck near someone for a prolonged period of time, and that, again, is the scenario in which viral transmission happens. So if you really, really have to fly Los Angeles to New York, New York to Dallas, you've got to wear a mask, got to have gloves, but I would really think about how really, really important that event is.
Dr. Emanuel, it's really good to see you this morning. You were signaling some signs of hope for the summer. Let's look ahead to the fall as well. I think we parents, students, principals, teachers are all trying to figure out what exactly to do come August and September, when students are expected to go back, looking for signs of hope for the fall, including Notre Dame announcing it will hold in-person classes on kind of a modified schedule where they'll go home for Thanksgiving and stay home till January. University of South Carolina doing something similar, and even NYU right on the island of Manhattan announcing it will hold in-person classes. How are you looking? I know it's only May and a lot can happen between now and August and September, but how are you looking at the possibility of public school students going back into our schools in this country?
Well, first, let me say that we have a forthcoming article in The Atlantic where we're advocating opening up summer camps, because they can be outdoors and you can have children. And if we do that, we can learn a lot about how to reduce transmission, how easy it is to get kids to wash their hands, to wear face masks, to stay in pods. And I think that's going to be important for thinking about opening up schools. In addition, for the fall, we can look at other countries that have done this, like Denmark, like Germany, and look at their experience. Denmark did it. They reduced the number of kids per class so that they could physically distance. So they basically doubled the number of classes. They put up tents outside so that you would be outside with better ventilation, but also able to reduce that class compression. You have to stagger the times that kids go in, stagger the pickup times. You might have to do alternating classes. For young kids where learning on screens is hard, this is probably absolutely essential. And we know school has a lot of benefits. And so I think that we need to begin planning now to open schools. Let me say 2 things. It is not risk-free, and some kids inevitably will get COVID. And the real worry, however, is not the kids, it's the adults, it's the teachers, the school administrators, and the parents if they, God forbid, bring the COVID home. Kids we know on the COVID, yes, we are worried about this multi-system inflammatory syndrome in children. There are several hundred kids now who have that. But we need to put the whole COVID situation in context. I was looking at the data from New York recently. There have been 16,000 deaths from COVID in New York, 10 in children under 18, 10. So, yes, it can be deadly in kids, but it's very, very rare. And I think the balance is there are lots of benefits to socialization in school, to education in school. And so I think we've got to be thinking about how we can do it safely, how we disinfect classrooms, how we have the physical distancing and the social distancing, how we serve meals to kids. Those are big logistical and financial challenges, but they're things we can do. And I think for the children, things we must do.
Well, that's some promising speculation on that. Let's hope it's borne out. Obviously, the kids want to go back. We want our kids to go back, and even on summer camps, too. All of our kids are dying to go to summer camp. I want to ask you about the vaccine, Dr. Emanuel. That's the study that's been done for Moderna. Obviously, very early in the process. They've tested it in a small group of people, and it shows some promising signs. Several phases left to go, but they have said if it does pass through these other trials, through these other phases of study, it could be available early next year, which, as you know much better than I do, would be an extraordinary pace to develop a vaccine. Some scientists, some public health officials have said, let's wait and see. It's nice to have a little optimism about this now, but there's a long way to go between now and a vaccine that is approved, number one, and can be widely distributed. So how are you looking at this new vaccine news this week?
Willie, you're exactly right. We've had a bunch of news. Moderna on Monday, yesterday, Johnson & Johnson announcing that Max had done well with their vaccine, and Inovio saying that guinea pigs had done well with their vaccine. So we've had a lot of announcements. It's very unusual to have these kind of announcements. And the main reason is people want to signal that it does appear, at least in principle, that we can get a vaccine, and that that vaccine in principle can raise antibodies that protect human beings from the coronavirus. And that does take away an uncertainty. Lots of people were worried that, it's not so easy to create a vaccine against coronavirus. And so this does say it does look possible, and it does look like the body will respond with antibodies. Whether that leads to protection from infection, and importantly, whether we can get older people who generally don't respond that well to vaccine to actually respond with antibodies and protect themselves is a big question. The other really big question, two other big questions. One is, as you've announced, the production of enough vaccine and the distribution and administration of that is no trivial matter. It's one thing to produce a vaccine, then you have to do what's called fill and finish, put it in bottles, make sure it's sterile, send it out. Then you've got to get it to all the people. One of the worrisome things we've seen from this coronavirus situation is that, in fact, immunizations with other vaccines have gone down 63% in New York City for other immunizations for children. That's terrible. Think about how we're going to administer to people if we're physically distancing, and that's going to be a challenge. I know that the annual flu vaccine at the University of Pennsylvania, we have long lines of people, and they go through very quickly. You stand in line for about 2 or 3 minutes and get it. But it's very, very hard to affect the physical distance. We might need an army of people to go house to house to house to administer such a vaccine. So that's very, very important. As you say, it's good to have hope, but we also need to be realistic that there's a lot to do between, say, June 1st and the time we're going to get it, which earliest will be next year. That would be record speed by any measure. But I know that people are really looking carefully at this because we want to make sure it's safe. We're going to be giving this vaccine to hundreds of millions of well people, and the last thing you want to do is make them sick.
Dr. Zeke Emanuel, that is for sure. Thank you very, very much for being on.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.